Okay, thanks so much for joining. We are going to take just a minute more, actually, about 3 more minutes to let people gather. And if you just put a one in the comments section below so that I know that you've joined. And we'll go ahead and start in 3 minutes. Okay, well, everybody should be here that's going to be here. I give everybody just a couple more minutes than we normally should. So we're going to go ahead and start now. This is Healthcare Compliance Solutions, Inc. And we are presenting on healthcare compliance training options, recognizing that isn't always the only option. So we really want to open it up to 3 different options today. We're going to be talking specifically about whether to train in-house, how to do that, what to look for, how to implement a culture of compliance, as well as talking about some of the benefits of just bringing in a consultant. We'll go pros and cons for both of those, as well as pros and cons for online training as well. Now, who am I? My name is Lance King, and a big driving force for me being a part of Healthcare Compliance Solutions, Inc. is that we help to protect families to ensure that they don't experience the frustrations that many families experience when there is a breach. In this picture, you're seeing my daughter Malia, and unfortunately, in this picture, she has experienced a lot of infection and virus running through her body. But the reason that I bring this up, and maybe you've heard, my wife, nurse, when we life flighted our daughter for RSV, she was very worried that with the number of patients in the hospital, that perhaps there may be some additional infection. She overheard that one of the children had pneumonia, and so she was very nervous and, in fact, approached the healthcare providers, the staff, and indicated that she was worried that if the staff don't sanitize and aren't wearing the equipment, then we're going to be opening ourselves up to a lot of infection. And our daughter really was in an awful spot at that time. Well, several times there were those instances, and they were very rare, very, very rare. Honestly, the staff did an amazing job. They really did. The problem was there were those times where they didn't wear equipment as much just to do quick checks, and our daughter ended up getting pneumonia and headed down a road that honestly we didn't know that she'd recover from. And so, uh, this was nothing that we felt to report. Once again, the primary children's hospital did such a phenomenal job. But I place an emphasis on the importance of the wearing of personal protection equipment, PPE, and I place an emphasis on how important it is to focus on the small and the simple things um, to avoid what really would have been a tremendous loss for our family. And so families are they they are impacted so much. And when you know about things that should be done and you witness that things aren't being done when we go to healthcare providers, boy, it is a frustration. And we hope that wherever you're at in your compliance program, this presentation will help improve your program. Now, I wanted just to say one last thing. If you've heard, I have also experienced with my wife, we've experienced identity theft. And so those that are focusing on their HIPAA privacy and security, once again, this is about families. Takes about 300 hours is kind of the number that we heard in terms of recovering from a breach of information. So please, please understand that your patients, they come to you for a problem. They come to their physician as a guide to give them a plan, to prescribe them some solution that could lead to a positive outcome or more more corrective and preventative action. And we don't want to have to think that the information that we give you could be breached. We don't want to think that there's any chance of any infection being spread or equipment not working properly. And so please take these things into consideration. And we at Healthcare Compliance Solutions strongly believe that the first place to start in any compliance program is with training. And so what to expect in this training presentation? Well, before we get into the training options specifically, I want to talk about employees, about how the employees contribute to a culture of compliance and some of the things to consider with your training program. Also, talk specifically about what is involved with training. I think fine with this presentation is that I'm going to invite you to consider for yourselves whether an online approach is best to outsource training, or whether you want to keep it completely in-house. And those of you that are doing it in-house, you're going to find that this presentation will be particularly important because, as you see in the third point to expect in this presentation, we're going to go through ongoing internal compliance procedures that should be implemented on a daily, on a weekly, on a monthly, on a quarterly, and on an annual basis, and in some cases semi-annual. And so this will be a great checkup from the neck up on things that are being done and areas that you have to improve. But really, you'll need to ask yourselves what is best for your organization in terms of how you're training staff and bringing them up to speed. I will say at the outset of this that just having a staff member go through a policy manual or watching a couple videos, while it's uh, it's definitely a step in the right direction, it is not, it is, repeat, not adequate. The fourth step is going to, the fourth point in what to expect is going to be talking on the culture of compliance, the ongoing nature of that. And everybody's on a journey, and we're all at different different parts of that journey, certainly. But we want to recap that and as well talk about some specific recommendations that we think could be particularly helpful in helping people to be alert and attentive to many of the procedures that are being implemented, many of the policies, and of course we're going to introduce our solution if you care to stay for that. Well, we recognize that 168 hours in a week, boy, we've all got the same amount of time. And when you consider some of the people in this world, some of their contributions to the world, you got an Einstein, you've got a George Washington, you've got all these individuals in history that have just done so much and impacted the world so much. And we look at our environments, and in the environment of healthcare, how can you not put patients first and your staff next, and then front desk duties and accounting, and certainly you've got to put fun in there. But boy, compliance. I talked to a doctor just yesterday who said when when finances are tight and there's a lot going on with patients, compliance is the very lowest point on the totem pole, if you will. And we understand that. We hope that this can be arranged a little bit differently, um, where compliance really is a part of what you give to patients. It's part of what you give back to staff, um, and it's involved in front desk and everything else. So just perhaps a different way of looking on this. And we often receive calls from clients uh, that ask for creative ways of training the staff. And I want to say that a lot of them are looking for creative ways to get the doctors to do their compliance training. And quite often, just as this doctor has his arms folded and maybe it doesn't look like he's paying that much attention if you were to be talking to him, unless you were pretty short in this case. But a lot of doctors, we learn they just don't really care. Uh, they care about the patient care, but what they don't realize is that patient care, it certainly extends into several different areas after they have cared for the patient with medical procedures and such. So, the again, we often hear the doctor just doesn't have time or just wants to review uh, policies and procedures that they purchased, and that's something that just doesn't happen. I mean, who wants to read through policies and procedure manual? That's just boring. Well, doctors that have gotten together, we discuss compliance often, and then doctors will get together and talk about what's best for them in terms of going online or just keeping things in staff or maybe hiring a consultant. One option as well is a seminar, but we'll kind of put seminars and online training as in the same pool. But the first man, if you look to the very, very left, he says, "What can I do about this leadership course, this compliance course?" The guy in the middle, I don't know what. I don't know. What do you think? And then the third guy, isn't there anyone we could ask? And really, there's wisdom in that question. When anybody's making decisions, certainly there's a hierarchy of how to make decisions. Do we eliminate the choice at hand, the decision at hand? Do we delegate it to someone? Do we outsource it to someone, or do we procrastinate and kind of put it in a holding pattern? and readdress it in the future. Well, I want to address your biggest liability, which often is overlooked. The biggest liability really is standing right next to you. It is your employees. It comes from within. And so, is it any wonder that training is important? Communicating to your staff so that they understand their boundaries. A brief story. We'll call the person in the story Donna. Donna goes through this experience where she has to terminate Kate. All right. So Donna felt confident that she had terminated Kate's employment with just cause. Within a week of Kate's firing, Donna received notice that Kate filed for unemployment insurance. Donna was surprised with the news. Kate was let go because she was doing something that was against company policy. She was, in the eyes of the organization, stealing and falsifying documentation. Donna thought that not doing these things was simply common sense. During Donna's conversation with the unemployment representative, he asked her a question that stunned her. He asked, "Do you have documentation that you've trained Kate in these matters?" Donna's reply was very similar to how many others might have replied in her situation. Why would I need to do training on something that's just common sense? Well, as you may have guessed, Kate began receiving unemployment benefits. If things aren't documented, such as training, you really have no measure to keep people accountable. And people make mistakes. So part of this presentation, again, is going to actually give you specifics if you're going to be training in-house, so that if this case ever happens where a disgruntled ex-employee leaves, you can have the reassurance that you have things documented and you're not going to be in Donna's situation. So the statement of your employees being your biggest liability, it might seem cold, maybe even harsh, but so are certain workplace realities. Employees really present the biggest risks to an organization. And what you're seeing on the screen are some examples where employees are a liability. And in some of these presentations, we have addressed several of these, but for simplicity's sake, we want to talk about compliance, harassment, social media, and employment termination. So please, I hope you will take some notes. I think this is particularly valuable to bring back to others in your organization. So as far as compliance, we have HIPAA, we have Osha, Medicare, etc. So this liabilities, we know humans are human, and sometimes their curiosity really does get the better of them. It just does, and you would be amazed on the number of cases that directly parallel what I just said, and that have led organizations into a huge breach. And in many cases, just small breaches where the organization has a sanction policy that then retrains the person or has to fire them if it's big enough. But just know that, I mean, right there, that as far as just the staff being curious, that really puts your organization in a liable position. So harassment. So employees have a bad history, just generally. I mean, as human beings, sometimes we can be a bit mean and spiteful to each other, can't we? And if an employee enters a department where they are either not liked or they're resented by the other staff, well, the other employees will make the unwanted employees' work environment unbearable until they are no longer there. And so that can put yourself in an awkward position. Social media. People love to vent their frustrations. They love to be the center of attention. They love to share things. And as it turns out, people now have a way to vent their frustrations about their jobs to the entire world. Employees of any organization are no different, really. And if an employee feels slighted at their job or doesn't like the job, the world is hearing about it. As far as compliance, I will say the last presentation that I had some case study examples where people at different job functions within healthcare took pictures of different, there was a record or an actual person, and posted it on Facebook. And those circumstances that they did not warrant uh, anything but a breach, because there was no disclosure that was signed by the person that did have their picture posted, especially one guy that was actually, he did pass away. This EMT took a picture of a guy that was dead, and basically saying, check out my job. Can you believe the things I deal with every day? And where the location was at, it sent that post to a bunch of people in that location, and things circled back to ultimately get him fired, and all that training and everything he had gone through was just gone. Last, employee termination. We talked a little bit about that. There always is a level of risk when an organization has to terminate an employee's employment. And although the supervisor feels that he or she did everything right, there are times when something unexpected comes back to bite the organization right in the bank account. And here are two factors to remember with this. First, that some employees, they will lie. And second, unemployment officers on the courts tend to leave in favor of the employee, particularly if the employer has little or no documentation to back up their side of the story, as we just heard. And so it just kind of boils down to a he said or she said kind of a situation. So that's kind of a taste of reality, kind of a reminder. However, with that said, here are some things that you can do to lessen the liability. So first, training and documentation. It is vital that any organization deliver training on every topic that is relevant to the organization. No matter how trivial it might appear, do not assume that people will just know stuff because it's common sense. Okay, again, back to that that situation we heard about earlier. In addition, it's critical that there's documentation of any given training. Okay, something, it may be just a quick line, a date, and a signature. And so, yeah, include the names of the attendees, the topics that were covered, and the date is kind of a good rule with any training. Next is policies and procedures. So having established written and communicated policies and procedures, it'll help an organization protect itself from employees who claim that they had no idea that was against the organization's policies. And of course, we can all see that. Everybody's trying to protect themselves, especially if you're fired. And so having written policies and procedures will also protect an organization if an audit should occur. Next is organizational culture. What does the culture within an organization say about it? And this kind of goes back to that 168 hours in a week. What are we giving with what we have to offer, our own personal value proposition, how we're contributing to the vision of the organization? And so that goes along with the culture. What you're contributing to that culture. For employees, the culture of an organization, it just says a lot. So having an organizational culture where the employees are supportive of each other, where there's a positive attitude, where there's an environment that fosters creativity and innovation, where new ideas and thoughts are free-flowing, it's going to help lessen the negative attitudes and the bad feelings within the organization. It also helps bring in the right type of person who would fit the culture within the organization. People tend to attract like-minded and action type of individuals. Last thing, just to kind of resurface this, so employee termination. This goes back to the idea of having effective policies, procedures, and documentation in place. Okay. So for example, if an employee quits, don't ask him or her to come back to the office to train another employee. When an employee quits, there should be no IT access to them, and they shouldn't be able to do any more work for the organization. They're just cut off. So there should be a written policy, and it should be followed the same way every single time. Establish that continuity from the very beginning of that policy, and avoid showing favoritism toward employees. And be sure that the managers and supervisors know to avoid getting too close and personal with their staff. That could be very problematic. And so managers and supervisors should have a mindset where they stay objective and focused on developing the employees, allowing their values, if you want to get at a personal level, to allowing the individuals to understand how their values contribute to the overall objective or vision of the organization. And that'll help them take more ownership in what they're doing as well. So employees, we know, staff, they're vital. They really are a vital component to the success of the organization. Part of the diversity of people's backgrounds and skills and personalities, they create that culture. But we just have to keep things in mind, keep the things mentioned in mind, and keep people grounded with the fact that employees need to understand that that they are a risk factor for the organizations. So organizations just a reminder to treat your employees well and give your employees every opportunity to succeed in their position of employment. However, it's up to you to protect yourself from liability that comes with employees just simply being imperfect people that make mistakes. And last thing I'll say about this, Dave Ramsey, if you know him, he teaches Financial Peace University and has an organization that is called Entree Leadership. And within that, they teach a bunch of principles about how small businesses and what to do with the leadership. And one thing I loved is they have what are called key results area documents with every staff member. Every staff member has some key results areas, and then they review these with the employees. And then as far as any incentive is concerned for that staff member, everything is tied to those key results areas. So when they have review times, they just review those key results areas. And when it comes to training, they know that these are the key results areas for these different staff members. And so it just helps them to funnel in. And in the case of protected health information, for example, this could also help you to understand what type of access your staff should have. So this is why we train in any healthcare organization. This is why we do what we do. Going into offices and out every day, it's because of family, right? I have been blessed with a wife and children, and I'll tell you what, we mean a lot to each other. And if anything happened to any of us, it would just be devastating. And so we rely a lot on healthcare providers. Certainly, I just went to the dentist. My wife and children went to the dentist, and my wife every once in a while will get a chiropractic adjustment, or because we're getting ready to have a baby number 4. We're going to healthcare providers, and people see healthcare providers on a regular basis. And so the bottom line is that HIPAA, OSHA, Medicare, employment law, they're very important because of the ultimate product of who we're serving. That's the family. And it's also important to note that with training does you know so when we think of HIPAA and OSHA and Medicare, it doesn't just suggest training. It's required that all employees receive compliance training annually, including management and doctors. But they don't simply recommend this or say if it's convenient, but that it is required for compliance. So the training is something that is required. It may be necessary to send messages reminding all staff fact and the importance of being in compliance for the safety of the patients and staff, privacy issues, the legal requirements, and financial reputation ramifications for the practice as a whole due to violation or non-compliance. So the point of this is just reminding people on a regular basis of the ramifications if they do breach, that these things aren't because these compliance regulations aren't put in place because of anything other than the ultimate objective is to provide amazing patient care. So have you ever seen these? These two CFRs discuss administrative requirements and for HIPAA privacy and for HIPAA security. Now, if you've never seen these before, that is okay. I put this in front of you just to say that in HIPAA and in OSHA websites, there are you can go to hhs.gov to learn all about these administrative requirements. And you can also go to OSHA, where they have a guide to compliance with OSHA standards. You can read all about that to determine the administrative requirements for that. And that's for medical and dental offices. And also Medicare. And most insurance companies also require attestation that all staff receive fraud, waste, and abuse training to maintain receipt of payment. And so with HIPAA, OSHA, Medicare, if you want to know where to go specifically for these things, you can look things up based on what I've just said, or I'm happy to share some links with you directly that can help you to understand the administrative requirements. I'm going to go through now the HIPAA, OSHA, Medicare, and employment law administrative requirements, things that should be implemented on a daily, on a weekly, quarterly, semi-annually, and annual basis. And within each of these, you can learn about a lot of these on the websites, but we hope that we can be a guide. We hope that you'll reach out to us because we have a tendency to go to a website and read a bunch of pages and just kind of freeze. That's because HIPAA has over 800 pages to read through. And so we'd like to be a guide if we can in instructing and helping you to do things in-house, if that's what you'd prefer to do. And I hope you'll ask some questions about these slides. So on a daily basis, some things to note, and I'd encourage you to kind of create a checklist out of these, something to put up on your bulletin board for staff to see. So daily, watching out for sanction policies. Again, staff members are curious, and as we are curious human beings, we also need to understand the consequences, the gravity to some of the decisions that we make. If we look at a record that we shouldn't, then there should be a sanction policy that says you get a warning, and you have to go through the policy that says do not record snoop. For example. So there are sanction policies that you should be aware of on a daily basis, and that should kind of help people understand their boundaries. Notice of privacy policy. Went to the dentist the other day, and I was very happy to see that I was signing a notice of privacy policy. And I actually asked to see more information about what they do to secure my information. And I think more people are starting to pay attention to that. The next is creating access controls and validation procedures. So really, this just has to do with who has access to different types of computers, and certain validation procedures that should be implemented by certain staff, privacy warnings that should be implemented, and sometimes that's just software. Sometimes it's staff helping each other out with that. Identifying breach. This should happen on a daily basis so that when you have your staff meetings, you can talk about different situations so that you can improve. Okay, breaches happen all the time. It's just that one breach that could put you into an audit. So you've got to identify breaches. As a compliance officer, you should identify which forms should be implemented. There are forms on a daily basis. The notice of privacy policy is one. Business associate contracts. Okay, you're using a lot more business associates, I suspect, than you think. And so make sure they have a business associate contract saying that they're following HIPAA. Also record complaints of anything, really. Disgruntled ex-employees are one way to be audited, but I would say just as prevalent in the industry are disgruntled patients. And then weekly data backup, quarterly update your training logs, semi-annually your billing and privacy audits, your security risk assessment with facility, environmental, and IT security plan. You'll notice with things like audits, you should have forms that you're filling out. Again, make sure that everything is documented and that you have a nice organized binder. Okay, and then we have OSHA. Okay, with OSHA, the compliance officers should be aware of personal protective equipment. And again, this is something that my wife had said was not focused on as much as she thought that they should have within the environment our daughter was in. But part of her awareness came because she was an OR nurse, and she saw on many occasions that somebody would be on the operating table and people they weren't sanitizing very well. They weren't wearing their equipment. So again, this is something that can be observed by a compliance officer frequently. Customized forms. Yes, there are a lot of forms for OSHA. In fact, in total, you're going to have about 100 forms in total that you should become familiar with when you're doing compliance. And whether you have somebody that's a consultant helping you using an online program that gives you reminders, or you're doing things in-house, you really have to be aware of which forms are out there, which logs you should be filling out, what patients should be filling out, etc. And certainly a code of conduct on a daily basis. And then quarterly, we have labeling. Certainly as you receive new machines in. Posters do change at a state and a federal level. Fire, building, electrical, and workplace safety plan. And that should be assessed, especially where safety comes in. And then training documentation. Staff should be trained on a quarterly basis for all of these standards, even if it's just a quick get together. Here's kind of a SWOT analysis, which is overseeing the strengths, weaknesses, opportunities, and the threats for the organization. Your material data sheets, and then annually workplace controls, waste management plan, customize procedures, as well as identifying work area and non-work areas for your staff and for your patients. With Medicare, 10 days after hire, they should have billing training, the person that's overseeing that. Also, periodically just spot check coding, make sure things are good. My wife and I, when ICD-10 was just introduced, we went to the hospital a few months before, and I remember seeing in the mail this bill that was probably $250 more than it should have been, and it wasn't even. We should have been paying about $60. And anyway, they fought us on it over and over again, but then realized that there were some coding changes, and knocked off that big chunk. So we were able to keep that in the savings account. Well, at least as long as we could. Right? Also, auditing your Medicare program. Okay, super important, and make sure to document your audits, and there should be forms. Investigations for corrective and preventative action if there are issues that do surface, such as with what happened in my case. And then kind of an ongoing effort that should be considered. And maybe you have this big, bold paper or poster that just says implementation, coordination, and evaluation of procedures and programs for Medicare. That really is an ongoing effort. Okay, and the last thing with compliance officers, probably one of the most neglected things we hear about is just human resources and employment law, especially at a smaller practice. I don't know why this seems to be so neglected. I think it's because we go back to that. It feels like common sense, and people should just know to do this or that. Okay, not a good idea to run your office that way. So have some training on compensation, business hours, outside employment, dress and appearance, which that can be difficult. You don't want to offend people, so certainly there's tact. Domestic partner benefit policy, insurance and benefits, vacation, sick leave, holidays, maternity, educational assistance, workers' compensation, Family Medical Leave Act, the FMLA. I find our guys here at Healthcare Compliance Solution, we're addressing variables and questions on that all the time, as well as non-competition policies. And we talk a lot about discrimination and harassment, which seems to be a huge problem. So on a regular basis, when you have those quarterly meetings, make sure you're talking about dress and appearance. Make sure you're talking about things like vacation, sick leave, holidays, and maternity. The FMLA and discrimination and harassment. Okay, these would be some excellent things to review. Well, I want to give you a recommendation. So with HIPAA, OSHA, Medicare, and HR, and if you'd like some help with this, or you'd like us to create something for you, let us know. We'd be happy to help out with this. So most practices have a whiteboard or something that's kind of a community space for people to post things. What we'd recommend is that you have an area that people know about that have kind of a graphic that shows here are kind of the HIPAA elements that we need to be aware of on a regular basis. And with this one, if you look into this HIPAA Privacy and Security walkthrough, we have one specific to employees, where employees and visitors wear ID badges. Employees challenge persons who are not wearing badges. Employees PHI by speaking softly, and when appropriate, using non-public areas. Another part to this is Workstation. So workstations and computer monitors should be positioned to prevent unauthorized viewing of PHI. Protect user IDs and passwords. Do not share them. Do not post user IDs on or near Workstation. Documents with PHI are kept away from unauthorized view. Documents with PHI are kept face down, filed, or stored when employee leaves Workstation. In use, are returned to login screen automatically or by user when not in use. Laptops, PDAs, we don't really call them that anymore, I suppose. But at any rate, some of us are a little old school. And another portable devices, we'll say tablets, are stored after hours with a lock of a key nearby, and then PHI is shredded or discarded in a secure container. Okay, so that's Workstation, and maybe this is something you put in your workstation area. As far as access, doors with access control mechanisms such as locks or swipe card systems are closed. Access to computer room is restricted to authorized personnel. Backups of PHI are secured in a safe area off-site and not near public areas. Access to copier, fax machines, and printers is limited to authorized staff. Office doors, filing cabinets, and desks are closed and locked when unoccupied. And lastly, after hours, office doors, filing cabinets, and desks are locked and our building is alarmed properly. Smoke detectors, as far as environmental, smoke detectors and fire extinguishers are operational accessible. Computer equipment is plugged into surge protectors, and where appropriate, where appropriate, uninterruptible power supplies are used. All right. So that is just a recommendation I wanted to share with you. I want to get into some of the options that we've talked about. So we've gone through a lot of what's required internally. So as you can see, internally, usually what is very clear at the outset of looking at bringing a program in-house, especially when you're a smaller practice, you wear a bunch of different hats of responsibility. It's just the simple fact that, hey, when am I going to be able to make time for this? Talked with a lady about 2 years ago, and she says to me, I think I'm failing in my internal compliance efforts. And I said, well, what do you mean? She said, well, about 8 months ago, I've said, all right, I'm going to have compliance done on this date. And actually, this was, she had just come into the practice, and so she was gung-ho, and she knew there was no compliance program. So she said, okay, I'm going to create this program. I'm going to make sure this doctor is good to go. Well, once she got into all these hats of responsibility, she had reminders that kept going off, and she just kept hitting snooze, if you will. And anyway, eight months later, she had missed her deadline of when she thought she was going to have people trained. And actually, this was just the training part. This wasn't even the policies and procedures. So, the time factor is definitely there. One thing that is always great about a compliance program that you have developed is that you can go through the things that I've just shown you with compliance officer duties. Create and customize your policies for your office, and an auditor will want to see that they're office and location specific. And so you'll have those created. They'll also want to see, when an auditor comes into an office, they're going to want to talk to the person that has been responsible for overseeing the integration of the compliance program. So they're going to want to make sure that the compliance officer knows what's going on an ongoing basis, to make sure it isn't just a once a year type of a thing. Okay. And with these options, I'm just going to say, sometimes the negative of having a consultant is that they just aren't familiar with the practice, and they're not there on a regular basis. Now, if you can get a consultant that can be there on a regular basis, we talked to somebody today that said that they had a consultant coming in every day, or every Monday. And I don't know what they're paying that consultant, but that is quite remarkable. And that can really help out if they kind of become almost an independent contractor for the practice. And we work with people all the time that are practice management consultants, and they work in a practice management group, and they can make a practice where they develop the practice policies and procedures, and they train the staff, And they may even train a new staff member after they've come on board. They may pull them aside and have a specific training for them, or maybe they wait for a specific day once a month where they're doing a training, and provide an incredible relief for anybody in a small practice. So we think that's a fantastic idea. Sometimes it can be a little bit more expensive than people like, where they'll be spending a few thousand a month. So you really just have to weigh that out. But as far as having somebody there who can coach you over time, if you wanted to be the compliance officer and you wanted a consultant to bring you up to speed and to train you over time, they can develop the policies and procedures, they can train, they can walk you through which forms to fill out, they can get you on track, and they can be right in front of you. So in-house is highly recommended. In fact, over time, again, the compliance officer, as I mentioned, should be the expert, especially if you're audited. You're really going to have to put your game face on and know what you're talking about. So in-house is what we lean toward. And I will just say that as far as online, you can mix the two. Some consultants do have access to, say, an online training, and then they just do procedures and policies and walk you through the forms. In-house, somebody that does in-house, they may just consider kind of buying things a la carte, where they use just a HIPAA training, but then they have Osha and Medicare outsourced, because CMS requires that fraud, waste, and abuse be taught meeting all of their requirements. So you may have that outsourced. Okay, so here are some options. You have options. We've just gone through a training which is giving you an outline, and as I mentioned, I can provide links for you of all of the different places to go where you can find the addressable items, meaning the policies and procedures, the administrative compliance procedures that should be implemented for your practice. Okay, I'd be more than happy to do that. One thing I will say about online is sometimes it can be a lot easier. You can track employees' progress and such, but you've got to keep them on task. You've got to make sure that you tie, again, their key results areas, that whole thing where you're constantly, say, once a year, some annually, reevaluating their key results areas. You should tie those moments that you have with your staff, where you're reviewing their job responsibilities, with things like compliance, and make sure that they're not getting a raise unless they've done their training, unless they are fulfilling their responsibilities if they are a compliance officer as well. So with ongoing training and culture maintenance, I've talked a little bit about culture. Really, when we talk and consider ongoing training and cultural maintenance, there are a few things we need to consider very closely. And the first is the patient provider relationship. This is something where, in order to deliberately create this culture that emphasizes PHI confidentiality, for example, often about the importance of trust in the patient-provider relationship, reminding your workforce that patients, they expect your practice to be a good steward of their health care information. We've talked enough about that. And one example I'll say that I've brought up several times is a story of a student healthcare worker, Catherine, fired from the University of Iowa Health Center for violating the privacy of a pregnant female student and her well-known student athlete boyfriend. And this happens so often. Well-known athletes, well-known superstars in the area. So what happened in this case where their information was breached? So Catherine, she works at this healthcare organization for 14 years, and she'd received all the training and everything. But what she did, she revealed to a coworker that she hoped the couple the positive results of the pregnancy test. Now, how did she find that out? Well, She inappropriately accessed their chart at least twice, opening the records from past visits, as well as looking at the medication records. And she talked to a clerk and pointed out, "Hey, there's that couple. I hope they're happy with the positive results." And then the clerk went and spoke to the medical assistants who treated the female student, and they ended up turning in this team member, Catherine. So just awful situation when she's been there for 14 years. So anyway, we need to speak often about the trust in that patient-provider relationship. The next is continually reminding staff to reminding them to safeguard patient confidentiality and the security of ePHI. So the actual how-tos. The next is making sure that there is a copy of policies and procedures for easy reference. And I'm also going to just go back to that pinboard poster. Developing something like that, or developing some quick reference checklists, huge in incorporating a culture of compliance. And this next point, addressing staff, this has to do with their questions and making sure to get outside resources if you need to, like a consultant or like somebody like us, or going to the internet and looking up some articles. We have articles all the time that we try to answer every question we can think of that would be asked when as far as compliance. And then, as I mentioned, reassessing job functions on a regular basis to determine with PHI, for example, what type of PHI access is going to be specific for that job function. And that goes into Osha as well, making sure that labeling is taking place and fulfilling the compliance officer duties, if that's where they're at. So a huge takeaway that I would take to your staff is just keeping people up to date. And in order to keep people up to date, you need to complete a self-audit. Okay, self-audits are just huge. And you can kind of do mental self-audits constantly with those posters, but in order to do an adequate self-audit, it's good to have a risk assessment. If you have kind of a quick risk assessment, you can check off a bunch of boxes, then that's a great resource. And we can actually provide one for free if you don't have one in your office. Your security risk analysis is something that should be done every year. And this security risk analysis, it helps you to identify, basically get a 360-degree view of all the safeguards, all the risk factors, and all the safeguards that need to be implemented in order to remedy any of the risk factors that could breach information. So an example is sometimes we hear about practices that are smaller. They'll start off using Gmail, and Gmail is not encrypted. So this would be a risk factor. And in order to remedy that risk factor, Google does have a feature where they do encrypt, but there may be some things within your IT system that may help beef up what kind of encryption you have. So security risk analysis is IT, environmental, hardware. It's also things such as your employees and what they're doing with things like social media, and we've addressed that in the presentation. So a compliance health checkup, we have a form that we've given many healthcare providers to do a quick checkup. But when doing an overall compliance health checkup, it's important to go through the policies and procedures, review what the dates are, and that's kind of what an auditor would do. If they came in, they would look at dates in your policies and procedures to determine how frequently you are adding these. And then you may have some questions if there are some recent updates where things needed to be applied or implemented right away, and to talk about the changes. Ongoing documentation, that's part of that is those customized forms. Again, there are over 100 forms that should be filled out on a regular basis for your practice. Training. Oftentimes, people forget when there's 100 forms, they forget about the forms. And so regular training are the ones that are implemented on a more regular basis. There'd be wisdom in addressing those at least quarterly, or semi-annually with the forms. But training, you should be talking about updates each quarter. You should be talking about some of the concerns. We talked about the compliance officer keeping track of any issues that staff have or the patients have brought forward. I mean, maybe you see some reviews on a Facebook post that were unfavorable. The next is business associate contracts. Okay, business associate contracts, that's one of many forms. But the problem with business associates these days is they're just not filling out these contracts. And they're not having a lot of healthcare providers are not updating these contracts on say, an annual basis, reviewing them and seeing who is serving your organization. And if someone says they have done or they will be HIPAA compliant, well, it would just be a great idea to make sure that they are HIPAA compliant, because business associates are one of the leading causes for breaches. And we hear about that all the time. We can send you several recent articles if that could help you at all. The next, as we go up clockwise, the risk analysis and risk management action plan. The security incident and breach management. You've got to know how to address that. In fact, we have somebody that works here, actually he worked here about 8 months ago, contact us and say that his children went to a healthcare provider in their community. And a few weeks later, they ended up receiving a letter in the mail saying that their information was breached and that they should keep their bank accounts, keep a close eye on their bank accounts and some other specifics to their identity. Okay, that was something that opened up their eyes on how important breach notification is. But a lot of practices don't have a specific sequence of how to do things. And again, if you would like some help, we'd be happy to help out. So here's the compliance health checkup, just kind of a quick thing that you'd go through on a regular basis. This complements a risk analysis that I'd be happy to send you as well. And we're not going to charge anything for that. If that can be helpful for you, we're happy to share that with you. Well, if I may, I'd love to just break down or unpack the healthcare compliance solutions that we provide. And we like to say that we make the pieces fit so you don't have to. You can see that there are several pieces to this after you go through that healthcare compliance checkup. And so if I may, I'd love to quickly review what we could offer. And I'll tell you, this is one of the most simple offers I've ever presented in my life. And we try to keep it simple because, well, you've got a lot of other hats of responsibility, is my guess. And we just want to make sure that you have the simplest way of implementing a culture of compliance. And so we do start most conversations talking about training. Yes, we do provide online training, but that is not the bulk of it. What I will say with our online training is that every user will have their own login codes. The administrator can add and delete staff. They're the only person that can do that, as well as track the progress of the training. And if the administrator of the program adds or deletes staff, determine that they want to also be the compliance officer for the different regulations, individuals will be the only people that can set up the training module. And within the training module, there is an official risk assessment that they'll go through for HIPAA. And for Osha, there's also a risk assessment / area where they'll customize some location and practice-specific policies and procedures. And that's a big differentiator with a lot of there are a lot of policies and procedure manuals you can just buy. I know I've talked with the ADA, people that have purchased from the ADA, and they'll send you something, but you'll have pages and pages that you'll have to fill out in customizing the information. And we make that really simple. At least we'd like to think we do. So the three main things that we do, we have this membership website portal, which has the training, has all your forms. It has a place to customize the policies and procedures, and it has a reference guide and reference documents. And anytime there's any updates that have taken place with compliance, well, we make sure to have that up there. Also, we provide compliance binders to put the compliance, the customized procedures that are created in the online program, as well as the risk assessment. And so you'll put that information in the compliance binders. And one of those binders in particular is for the auditor. It's called the Compliance Plans Binder. Pretty novel name, isn't it? Ongoing support is the third thing that you can expect with HCSI if you think that this could be a good fit for you. And all I'm going to say with that is you can call us or email us for anything. Quite often we'll go the extra mile and help you to create something. As far as a policy is concerned, we'll help you innovate of different ways of keeping staff aware. And ultimately, our goal is to help you create a culture of compliance. We feel like the best way to do that's with the compliance officer. And so the way we do it specifically is we'll have an implementation specialist contact whoever that compliance officer is on a quarterly basis, and they'll assess the membership website portal. They'll assess your binders, and they'll provide recommendations in any of the areas that you need to in updating your program. So within the training, there is HIPAA Privacy, HIPAA Security, Osha, Medicare, and Employment Law. We're an all-in-one training, so you basically pick and choose whatever you want, kind of like a buffet table. Most of the time people find that HIPAA and Osha, those are the most common reasons people will go with HCSI. As far as the binders are concerned, there's a reference guide, that compliance plans binder that I mentioned, and then a certificates binder that you'll put all your training certificates in, as well as your quarterly training when you go through so we'll send you a newsletter, and I'll show you what it looks like. So there it is. That picture is what's called our compliance training advisor. And this advisor you should be reviewing with the staff every quarter, and then they can sign and date that, and you can tuck that away in the training binder. So this just gets into a little bit more of the implementation support we provide. So we do provide weekly and monthly updates through email. It's mailed. You can call or email us at any time, and we do that quarterly assessment with the compliance officer each quarter. Here are some of the forms that we have. They're all customized. Here's a testimonial that I love to, I'll give you two testimonials. Just these are two of my favorite. So after HIPAA and OSHA compliance was a huge concern in our office, especially after one of our employees filed a complaint with OSHA. We started using HCSI 4 years ago and couldn't be happier with them. It's simple to set up and easier to use. Do yourself a favor and sign up. It'll make your life easier. Now, I will bring this customer testimonial up because we hear quite often that people file complaints. Not too long ago, I learned about a concern someone had where they're just the cords that were plugged into computers and to various equipment, that they just looked like spaghetti all over the place. And this girl, she kept complaining, and the doctor just kind of ignored it. Well, when she left, she called OSHA and said, hey, this was a safety concern. This was what she said was one of the reasons that I'm sorry, she didn't just leave. She was actually fired. But she said, I complained about this several times. I can't remember if she documented things. There would have been wisdom in that. But people do file reports quite often. The next is HCSI kept my fanny out of the who's cow. I don't even know what that means. With a cranky patient who thought we'd been naughty in multiple ways. Our association with you made all the difference. We passed the inspection with flying colors, and OCR told the patient to bug off. Loved it. So the reality is, people are being audited. This is somebody that's been with us for a long time, and disgruntled ex-employee, disgruntled patient. These are some of the top ways of being audited. So if you come with us, certainly there's a 30-day money-back guarantee. We've never had to. I've never seen that given back, just because honestly, once you set up with HCSI, we are a leader in so many things that we do, but really, with how simple this is and how cost effective, I think you'll be amazed. And also, if you think about that culture of compliance, well, we certainly help in you retaining and increasing the patient retention, which hopefully can help your business to become to thrive a lot more. And we have a lot of recommendations on how that happens. But if you're spending a lot of money on retention, in addition to the price savings you're about to see, well, you'll be able to save on advertising, because we are confident that over time your patients' trust in your reputation will just continue to increase as they see things that you're doing to protect them. So here's the price breakdown: compliance officer training, employee training, risk analysis, customized compliance plans, customizable forms, posters, compliance updates, phone and email support. So this adds up to about $3,000. It's quite a bit less than you'll find with most with a lot of consultants that they'll charge you for maybe even just a month of what they do. And that's not to say all consultants. Everybody is running their own show. But one thing that we're offering right now is a 24-hour discount of $300 off. And so if you'll email within 24 hours, you'll receive a discount code. Just email lking@hcsiinc.com. The discount is actually a discount off of our 1 year. For 5 years, if you determine that you just want to pay up front for 5 years, it's $2,600 base plus $3 per employee. So if you have 10 employees, it's only $30 on top of the $2,600, and then $11 to ship out your books. And then for 1 year, it's $1,189 base plus $3 per employee. So again, if you have 10 employees, then just add $30 to $1,189. Okay. So we're happy to give you this discount if this makes sense for you. If after you've gone through this presentation, you determine, hey, outsourcing through an online resource such as HCSI, that really is the best fit for us, then we would love to support your efforts. Compliance officers specifically want to make sure that they have some autonomy and make sure that they're confident in how to communicate a culture of compliance, which forms to be implementing, which procedures in particular need to be implemented during, say, the next 3 months to make sure that they get into a routine of implementing those, etc. And we will support implementing the customized policies and procedures, not only just in how much more organized they'll be than maybe some of the policies and procedures that I've seen in healthcare practices that look like this, but our quarterly support calls, they really will have an emphasis of different things to implement over time. And I think you'll be amazed on the recommendations and the support. We've been doing this for about 33 years now in terms of supporting healthcare practices. We started off with policy manuals and have just evolved as regulations have come out. And again, with our 3-step solution, providing training, providing implementation support and policies and procedures, I mean, those are the 3 main things that we do. I really think you should give us a call or email us. We'd love to be your compliance business partner. My name is Lance King, and I am super grateful that I was able to present on healthcare compliance training options. If this has been valuable to you, will you put a 2 in the comments section below? And if you'd like me to reach out to you, please put a 3 in the comments section as well, and I'll reach out to you. Well, I'm on LinkedIn. I'd love to connect with you there. And I hope that you'll, again, reach out to us for the discount, $300 off within 24 hours. And other than that, hope that you make it a great day and enjoy a fantastic weekend. Thank you so much for joining.